what is the difference between a cardiac arrest and a heart attack? I get this question from friends, family, so many different people. We hear these terms kind of thrown out, but are they the same? Are they different? Let's stay tuned. Let's find out. Hi, friends. It is Dr. Bernice here, and welcome to Teaching Thursdays with Dr. Bernice. I'm so happy you guys joined. So this series, we break down some medical misconceptions and we make them clear for the people. Today, we're going to be talking about something that really confuses a lot of people. A heart attack is not the same thing as a cardiac arrest. A heart attack can lead to a cardiac arrest, and we're going to get into that in a second. They're not the same though. Let's just start talking about the heart as a concept. So we know the heart is located right here. If you put your hand on your chest, you can feel it thumping. What it's doing is that it's literally squeezing blood throughout your body. That blood is carrying oxygen and critical nutrients throughout your body so that all of your organs can function. Your brain, your kidneys, your lungs, your muscles, like literally everything is counting on this pumping motion of the heart. In order for the heart to keep doing this pumping motion though, it has arteries that surround it. These arteries are also delivering oxygen and nutrients so that the muscle of the heart itself can do the pumping. A heart attack happens when one of those arteries gets a blockage. And if you think about those arteries kind of like a pipe, if you get a really thick blockage, and sometimes it's a blood clot, and oftentimes it's actually fat that can accumulate on the inside of the arteries from high cholesterol and other kind of issues with lifestyle. You get a blockage, and then that oxygen is not delivered to the muscles of the heart. Now the muscles of the heart start to die. That's why you get really severe pain a lot of times whenever you're having a heart attack, because it's literally the sensation of muscles dying. Some people will have other symptoms, like they'll feel short of breath. Some people will describe a tightness rather than a pain. There's a multitude of symptoms that will present, but just know that this is an absolute emergency. If you come to the ER, I'm gonna order an EKG, and that heart rhythm is gonna show me certain telltale signs that show that there are parts of this heart muscle dying, and you need to go see a cardiologist in the cath lab immediately and get that clot managed. So that's a heart attack. What's a cardiac arrest though? Cardiac arrest is when you have this pumping motion of the heart, it stops. It is, by all intents and purposes, the definition of dying. You've literally died because, like I described earlier, if this heart is not pumping that blood forward, you no longer have blood, oxygen, nutrients going to the rest of your body. And what's really scary is that organs like your brain particularly cannot last but a few minutes without that critical oxygen. Your brain starts to die immediately. You don't get the oxygen, you don't get the nutrients, it starts to die. And that's why when you see people who have had the arresting of their heart, even if we're able to restart their heart later down the line, a lot of times they'll end up being brain dead because the brain just has no type of reserve if it doesn't get the blood and it doesn't get that oxygen. So the ways though that a heart attack and a cardiac arrest are linked is sometimes that blockage that we talked about that stops the heart from getting the nutrients that it needs and leads the heart muscle to die can lead the heart to go into a dangerous rhythm and then stop pumping effectively altogether, leading to a cardiac arrest. So we talked a little bit about the symptoms of what you would see in a heart attack, things like chest pain, chest tightness, shortness of breath. Those are all reasons to emergently get checked out and make sure that you're not having a heart attack, especially if you have risk factors for one. In a cardiac arrest, a lot of the time, you'll see somebody collapse because they're not getting that blood pumping action. Most of the time, they'll collapse to the floor, they'll go unconscious. Sometimes they'll complain of chest pain before the event, sometimes they won't. And you might see what looks like breathing, but it's what we call agonal breathing, where they're truly gasping onto any type of life that they could have while their body is actively dying. You are going to go to that person. First, you're going to try to agitate them awake. Hey, sir, ma'am, call their name. Are you awake? If they're not giving you anything and they're still doing that really scary gasping for air motion, now we're pretty worried. So what are we doing at that point? One, we're calling for anybody around to call 911. You're calling for someone else to go get an automatic electric defibrillator, an AED. And they're going to come and bring it to your side. Listen to me. This person is not alive, but they might have a chance. In that moment, you are taking over the pumping of their heart. You are going into chest compressions. That means you are going right to the center of their chest, and you are putting your heel of your hand over your heel of your hand right into the center of their chest, and you are pushing down hard and fast. You are doing CPR. What are you doing when you do CPR? You are now pumping that blood that the heart muscle is no longer able to pump. You are now pumping that blood up to that person's brain so their brain doesn't die. You are pumping it and you are supplying blood and nutrients to their kidneys, to their lungs, to everything critical in their body. And that person that you called to get 911 is going to get an ambulance to your side so that that person can be transported to the hospital. And the person that you called to get an AED is going to bring one to the side. And once you put those pads on their chest, the machine will do all the work for you. It will analyze the heart rhythm. And if it's something that can be restarted with some electricity, those pads will go on there and it will shock the heart back into a normal rhythm so it can go back to doing that normal pumping rhythm. If it's not in one of those abnormal rhythms that can be shocked, all you're doing is pumping on that chest until the paramedics come. If you get tired, you switch out with a friend. You say, hey, I need help, but we got to keep this person alive. You are taking on their heart's work. It is absolutely tremendous what you can do. I'm telling you, as an ER doctor that works at a hospital that sees an incredible number of cardiac arrests, I see a devastating number of people who come in and nobody has done this life-saving thing for them. And it breaks my heart because at this point, I have run many codes, many cardiac arrests, and I can restart a lot of people's hearts. I cannot restart your brain. Once your brain has not gotten that oxygen and those nutrients for more than just a few minutes, I cannot restart your brain. Doctors cannot restart your brain. It is the reality of the situation. You guys out there in the field, the people in the community, in the homes with the family members, it is us together. We're a team. We can really change the outcomes for the people, okay? So we've gone over a lot of different things here in this video. We've talked about a heart attack. That's something that we hear about all the time. When you go into the hospital, you might hear the term myocardial infarction. And again, that's when that clot of either a blood clot or fat or something clogs up the piping around the heart, causes part of the heart muscle to die. In some cases, that can lead to an abnormal heart rhythm that leads to the heart stopping. There are other causes of cardiac arrest, but a heart attack is one of them. When the heart stops, it is time for us to tag in and do that CPR and save that person's body, save that person's brain, save that person's life. That is where we tap in. Does that make sense? I hope that makes sense. We talked about a lot today. And it's kind of a heavy topic, but I really do think that we could talk about hard things. I think that we can really just make the world a lot better if some people just knew what to do. So I hope you learned something, and I hope you send this to your friend and your cousin and your auntie and your grandma and your neighbor and your classmate so that we can save everybody's lives. How does that sound? Okay, I hope it sounds good to you. I appreciate y'all. Thank you for tuning into this series that is targeted to patients, healthcare workers, and medical trainees. We got a lot to talk about, and there's much more to come. I am Dr. Bernice again, and I hope to see you back soon.